This video will explain the most common medications used for people who are living with heart failure. We recommend having a list of your medications on hand to review as you watch this video. Heart failure, which is sometimes called congestive heart failure, is when the heart muscle is not able to pump enough blood to meet the body's demand for blood and oxygen. If you are living with heart failure, you probably have had an echocardiogram. This is an ultrasound of the heart. It can help your doctor to diagnose and monitor your heart function. It is also where we can see the ejection fraction, or the percentage of blood your heart pumps to your body per contraction. It can be classified into two main types: heart failure with reduced ejection fraction, or HFrEF, where the heart cannot pump effectively, and heart failure with preserved ejection fraction, or HFpEF, where the heart can pump, but it is stiff and does not fill properly. It can cause symptoms such as shortness of breath, fatigue, fluid retention/swelling, or reduced exercise capacity. It can be caused by many different things, but some of the most common ones are high blood pressure, coronary artery disease, or previous heart attacks. Heart failure is a chronic condition and can worsen over time. We manage this condition with exercise, diet changes, and medications. In cardiac rehab, you will work with our team to safely increase the amount of exercise you are doing. You may also have been advised to lower your sodium or salt intake and/or to limit how much fluid you should drink. These two things can help reduce fluid retention/swelling. If you are living with heart failure, your doctor likely prescribed you some medications for this. This video will discuss the most common medications prescribed for people who are living with heart failure. Taking your medications regularly is one of the most important things you can do for your heart health. They help the heart heal, get stronger, and feel better. These medications have been shown to improve quality of life, reduce the likelihood of going back to hospital, and extend your life. If you are tolerating them well, you will likely be on them lifelong. There are 5 common classes of medications that are prescribed if you are living with heart failure. 4 of them help the heart function itself, and 1 of them helps with symptoms of heart failure. Before we talk about each type, it is important to know that many medications have 2 names. This can be confusing. Make sure you have an updated list of your medications with you, and try to become familiar with both names. You can keep this list in your phone, wallet, or purse. Renin-angiotensin-aldosterone system inhibitors. There are 3 classes of these. 1. Angiotensin-converting enzyme, or ACE inhibitors, medications that end in pril. 2. Angiotensin receptor blockers, or ARBs, medications that end in sartan. 3. Angiotensin receptor/neprilysin inhibitors, or ARNI, called Entresto. These 3 classes of medications are similar to each other. If you have heart failure, you are likely on one of them. You should not be on more than one. These medications are used for 3 reasons. 1. They help the heart muscle recover or strengthen. You may be prescribed this medication even if your blood pressure is normal for these long-term benefits. 2. They lower your blood pressure. It is helpful to monitor your blood pressure regularly. If your blood pressure goes very low, or if you feel lightheaded or dizzy, contact your cardiac rehab nurse. 3. They have been shown to lower your risk of another heart event. Often, we start these medications at low doses and gradually increase them if you are feeling well. You will likely be on these medications lifelong. What to watch for. These medications are filtered out of your body by your kidneys. It is not common, but they can cause changes in your kidney function or electrolytes like potassium. You should have your blood work checked after a dose is increased. They can lower your blood pressure and sometimes make people feel lightheaded or dizzy. You should monitor your blood pressure regularly. The ACE inhibitors can also cause a dry cough. Beta blockers. These are the medications that end in LOL. Examples include bisoprolol, metoprolol, and carvedilol. These medications are used for several reasons. 1. They have been shown to help the heart muscle recover if there has been any damage. 2. They lower heart rate, also called your pulse. This allows the heart to spend more time relaxing and makes it a more efficient pump. It is good to check your pulse regularly at rest to make sure it is within a normal range. A healthy adult heart rate is 60 to 100 beats per minute. For people with coronary artery disease, we typically aim for the lower part of that healthy range, or even as low as the 50s. 3. They lower blood pressure. This makes it easier for the heart to pump. Again, it is helpful to monitor your blood pressure to know it is at target. We often start these medications at low doses and gradually increase them if you feel well. If you are doing well with them, you will likely be on these medications lifelong as well. What to watch for. These medications can cause low heart rate or low blood pressure. Some people experience lightheadedness or dizziness. They can also cause fatigue in some patients. Another potential side effect is erectile dysfunction, difficulty starting or maintaining an erection for males. If you are experiencing any of these side effects, talk with your doctor or nurse. Mineralocorticoids, or MRAs. The two main MRA medications are spironolactone and eplerenone. They were originally used for lowering blood pressure. They are still used for this, but they are now also used for heart failure. This type of medication helps by blocking aldosterone, which can help prevent the heart from becoming stiff and improving how the heart muscle pumps. What to watch for. The most common side effect of this medication is low blood pressure. Sometimes it can make you feel dizzy or lightheaded. If you are taking one of these medications, you should monitor your blood pressure regularly. This medication can also cause the level of potassium in your blood to increase. You should have your blood work done to monitor for this. Serum glucose, cotransporter 2 inhibitors, or SGLT2Is. Originally used for patients with diabetes, the SGLT2I medications, empagliflozin and dapagliflozin, have also been shown to help improve heart function, even if you are not living with diabetes. This medication works by helping to regulate the pressures inside the heart and blood vessels. What to watch for. There is no special monitoring to be done with this medication. Most people feel fine with this medication. Rarely, it can cause bladder infections or gynecological infections, particularly with women. If you experience this or any other side effects, contact your primary care provider or cardiac rehab nurse. Diuretics, also known as water pills, help with fluid retention or retaining water. It is common for people living with heart failure to experience fluid retention. The most common diuretic is called furosemide or Lasix. Some signs and symptoms of fluid retention are swelling in the feet, ankles, and/or lower legs, difficulty breathing when lying flat, waking up gasping for breath, reduced exercise tolerance, or rapid weight gain. Some people need diuretics to help remove the excess fluid. You may be told by your medical team to take it regularly, or you may be told to take it as needed, or based on your weight. What to watch for. You may be asked to weigh yourself each day. This is the most accurate way to monitor for fluid retention. Please make sure this is done first thing in the morning, after you pee, and before you eat or drink. You will also be asked to watch your symptoms, like difficulty breathing, swelling, ability to exercise, and your blood pressure. You may also be asked to have your blood work checked to assess your kidney function and your electrolytes. It is very important to take your medications as prescribed. Your doctor, nurse, or pharmacist can help you make a good schedule for taking your medications. There are many reasons why people may not take their medications as prescribed. If taking medications is new for you, it helps to make a consistent habit of it. Perhaps you don't feel well or are experiencing side effects. Contact your nurse or doctor to discuss these concerns so we can consider options for you. We want you to feel well on your medications. If paying for your medications is a problem, please let your nurse or doctor know. There is a lot of information on the internet about medications. Some of it is reliable, some of it is not. If you have been prescribed a medication, you deserve to understand why. It is best to speak with your medical team or pharmacist to get reliable information. If you are struggling with any of these concerns or others, make sure to follow up with your cardiac rehab nurse. We want you to feel well and confident with your medications. If you have questions or concerns related to your medications, talk to your doctor, nurse, or pharmacist.